Good evening, ladies and gentlemen, and welcome to the inaugural lecture by Professor Ross Kane. So this is the latest in our series of inaugural lectures that are given by our newly recruited or newly crowned professors, where they outline their areas, show their areas of expertise to us, and let us share their interests. Today's is going to be just very slightly different in the sense that when I was a child, I used to have a jumper that had hello on the front and goodbye on the back. It's the first thing we subject our children to. So it's a little bit like that. So this is Ross's inaugural and farewell lecture. Two for the price of one. And I know it will be just twice as good. So just a little bit of housekeeping. If you hear a fire alarm, we're not expecting a fire alarm, we're not expecting a fire either. But if you hear a fire alarm, fire exits are there and there. So sprint to the car park, and I hope you make it. If you need the facilities, just head out and straight round to the left, and you will find all that you need there. So I will now hand over to Kirsty Miller, our Pro Vice Chancellor for the College of Health and Science, who will give Ross a talk.
Thank you very much. I do feel I should say, please walk in an orderly fashion if there is a fire alarm. No running. Roz, this is going to feel very uncomfortable for you, and I apologise now. So Roz is a professor of nursing and public health, obviously, at the University of Lincoln, where she's worked in the School of Health and Care Sciences for the last 20 years, or Health and Care Sciences for the last 2 years, and Health and Social Science.
So
what were we before?
Social care.
Before that. Her career is defined by a distinctive interdisciplinary perspective. Originally a registered adult nurse, she then moved into a BSc in anthropology and geography, followed by a master's in medical demography, and then a PhD in public health. And it's this blend and of disciplines that really adds to the unique expertise that Roz brings to us. So she worked at the London School of Hygiene and Tropical Medicine for about 10 years, and we are so pleased that she then made that decision to move to us at the University of Lincoln. Roz is a prolific author and income generator, over £21 million over her career, and a range of funding bodies, the National Institute for Health and Care Research, Cancer Research UK, Macmillan, Cancer Support, and NHS England. Her influence extends nationally and internationally through both her visiting professorships, her fellowship of the European Academy of Nursing Science, and her chair of the Udine. Sorry, she only just told me this as well. Udine C International Network of Nurse Academics. Roz also takes her academic citizenship incredibly seriously, serving as both editor and peer reviewer for a wide range of funding bodies. But what stands out for me in Roz's career is actually that not only the quality and the range of her work, but the way she brings people with her colleagues, her students, clinicians, researchers, and communities. I should admit that Roz and I used to share a train commute. And I remember on meeting Roz being quite intimidated and awed by this person.
Wow.
Not just because of the... Yeah, not at that point. And not just by the depth of her intellectual and professional expertise, but also because Roz has that rare ability to be able to enthuse and engage people from all backgrounds in research, in the importance of research and the influence that it can have. Her own research portfolio spans key areas of public health, including sexual and reproductive health, cancer survivorship, domestic violence and abuse, and workforce development. And in the latter area, she has led the Clinical Academic Careers Internship Programme across the East Midlands, helping to empower the next generation of health and social care researchers. Through all of this work, Roz has been instrumental in shaping the research landscape, not only at Lincoln, but also nationally. Not only through the evidence she's generated, but through the people she has supported, challenged, and encouraged along the way. Her support and guidance has helped many colleagues at Lincoln to reach their career aspirations and to consider the impact of their work in a different way. Tonight, Professor Kane is going to join us to share insights from a career dedicated to the belief that robust research is the cornerstone of compassionate, effective healthcare. And please join me in welcoming Professor Roz Kane.
Thank you, Kirsty, and thank you, Simon, for those lovely introductions. And thank you, everyone, for being here. This is really quite bizarre. I'm not going to pretend otherwise. I'm really moved by the number of people who are here, but actually, because of the distances that many of you have travelled to be here tonight, it's really kind of blown me away. So very much appreciate that. And it's fabulous to have my family in this little corner of the room, which is even more bizarre. So here goes. As Simon said, this is quite an unusual occasion tonight because it's very possibly unique to have an inaugural lecture that actually coincides with the time when I'm about to step out into my retirement next month, very soon. And so for that reason, I've decided to take quite a kind of personal approach to the talk tonight. So for those of you that I don't know personally, I know there are some members of the public in the room, please bear with me. Some of this might be a little bit sort of individual and unique, but I hope nevertheless there are some useful insights for everybody. Because whenever you're asked to do an inaugural lecture, and of the many that I've been to over the 30 years that I've worked in the university sector, they tend to really vary from giving kind of unique, really supreme intellectual academic insights, which, to be fair, was never really going to happen. I don't think that's my style, to much more personal approach. And I've always personally enjoyed the personal feel where you kind of get to know the person speaking. So I've gone very much to that end of the spectrum. But I've done that not just because this is the time before my retirement, but what I'm hoping to do over the next 40 minutes or so is almost like tell the story of my career. So I am going to take you back chronologically in a moment, but because uniquely working as a nurse, but moving across into the academic sector, I want to be able to draw on some of the parallels there, but also some of the reasons why having a nursing background has really, I think, helped me and influenced my direction in many ways throughout my career. So I just want to kind of introduce this concept of a clinical academic. Now, this is quite a well-known definition, and it's particularly well-known to some people in the room because I think they probably wrote it. But the idea, and this is kind of, I suppose, the thread running through, is the idea of a clinical academic is that concept of a nurse in the first instance, and in my case, but also more broadly other health professionals, social workers, public health practitioners and so on, who really become engaged and embedded in research, but actually stay clinically active or active in their professional practice, whilst also becoming experts in research, to really make the bridge between that kind of clinical practice and that academic practice. So I, as you will see, don't define myself as a clinical academic, and I'll walk you through why that is the case. But I want to talk about some of the body of work that I've done alongside other amazing people who are in the room to try and start to establish that kind of infrastructure for people that do want to have that kind of career where they do stay embedded in clinical practice. And over 30 years of working in the university sector, as you can imagine, there's a lot of stuff that's happened. There's a lot of research that I've done, that I've been involved in, and I've kind of grouped it into these 4 key areas. Now, it's not my intention to go into any individual details of any of these studies, because as you can imagine, there's just far too many. But what I've done is taken the approach of having more of a kind of an overview. But I will come back to just highlight some of these later on. But before that, I just want to take you back to the beginning. Well, not completely to the beginning, but this was my first week as I joined my nursing course. This is the 6th of January 1986, and I was 18 years old, and I'm that one there. Perms were in fashion, I promise you. And I joined this cohort of people. There should be one other person who joined us later, a great friend of mine, Louise, who I'm still in touch with. And we were thrown together for 3 full-time, really intensive years of training. And I think something happens to a group when you have that sort of intensity. and you do develop a bond and you become very close. And I'm absolutely thrilled. Even 40 years later, I'm still friends with and still in touch with lots of people that are in this picture. And actually, one of them is right here in the room tonight. Sorry, Jane, don't want to embarrass you. And Jane and I sat together on the first day for 6 weeks, all through our first weeks in the classroom. And, you know, a lot of these people went on to stay clinical. I think pretty much everyone did, actually. But they became the experts, the very senior leaders, managers, matrons, and so on, that then became the people that supervised and were the role models for our students later on from Lincoln. And you'll notice that we're all in uniform, which I think, given that this was a 6-week stint in the classroom, is actually quite bizarre to think about it now. But I think there's definitely something there about helping us to identify as nurses and start to feel like that sense of like togetherness and identifying as a health professional. And so we had really, I think, excellent experience. I think we had really good, intense nurse training. And I think I can probably speak on behalf of the whole cohort when I say that we came out feeling really well equipped and ready to move on to work as qualified nurses. And I've put a picture of this book up, and some of you will recognise this. I toyed with the idea of actually bringing this in with me because, believe it or not, I've still got a copy of this. And this is the first book that we were all told to buy. It's very thick, it's got very thin pages, tiny small writing. And I very dutifully basically just read and learned this book cover to cover pretty much over that 3 years. And it served us very well when it came to the final exams to be able to draw on that, all the information that was in there. And I've looked at it recently, and what really struck me about this book, it was an excellent resource, but actually it was very focused on learning to become a hospital-based nurse. And that is what we were all doing at the time. But as I look back through a different kind of lens, nursing has changed so much in those 40 years. So there's stuff that wasn't in this book. There's very little about research, if anything. There's very little about health promotion or prevention or public health or those kind of wider determinants of health, which is what throughout the years I've kind of gone on to research in that area. So I think it was a perfect experience at that time. But looking back now, 40 years later, the landscape has really changed and nurse education has really changed in that way. So on qualifying, I immediately left the area and I got my first job as a staff nurse here in this beautiful building, which some of you might recognise is even there now. It's actually right next to Euston Station on Euston Road. So I moved to London and worked here for a few years and became a women's health nurse. I worked in gynaecology. And I absolutely loved it. But it was then, when I started to work every day, clinically active, you do start to notice things that maybe could be done differently. What are the kind of gaps in service provision and so on. And I did start to get curious about research, about the potential to kind of examine and explore some of these unknown concepts. But at no point back then did I ever think about becoming a researcher, or didn't even occur to me that actually nurses could do that. Nurses could be researchers. So I was there happily for a few years, and then I decided actually I wanted to go off to university. And it would be disingenuous of me to say that I did that to train to get a degree to become a researcher. I think that would have been a better story, but actually that's just not true. I just was curious and I had a thirst for learning still, and I wanted to carry on learning. So I tutored off to UCL, and the real reason I went is because of this person here, who's my younger sister, who's in the audience right now, and I don't think I've ever told you this, guys, but it's because she's younger than me, but she then went off to university. And in my kind of cohort at school, that wasn't the norm. I didn't even stay on it to do A-levels initially. I left at 16. And it was when my younger sister went to university, I thought, actually, that seems like a good idea. I'm going to have a go at that. So I went off to UCL and studied there for 3 years, which was a fabulous experience. And where many of you will know the great Jeremy Bentham still presides over the Great Hall. And this photograph was taken by my son a few weeks ago at who's now also studying anthropology at UCL. So that's really sort of satisfying for me. He actually took it at 4 o'clock in the morning because he was doing an all-nighter just before an essay deadline, but we won't go there. So at this point, I'm still not a clinical academic, but I've been reflecting back on this, and I've been really thinking about actually having already trained as a nurse, that did influence my experience as an undergraduate student in a couple of important ways. One was because I just did loads of agency nursing because I could, to earn money to fund my studies. And also it influenced, I guess, my choice of modules. I tended to focus on things about medical anthropology, social determinants of health, reproductive health, and that kind of thing that I possibly wouldn't have done if I'd not previously been a women's health nurse. So, but in no way am I claiming that this was a kind of clinical academic integration at all. It was actually almost just coincidence, really, at this stage. And then after that, I applied to do a master's, I stayed on, and I got accepted on a master's degree at this amazing institution, London School of Hygiene and Tropical Medicine, where I did my master's, and then I got a job there for 10 years, ended up working there as a research assistant and a lecturer. And it was really quite incredible to, be offered this job at an organisation that, books have been written about this place. It was a really established, historical, global leading university for public health, actually. And I was just really happy and proud to be there and to be associated with it. And not least because I met these two amazing women who are both in the audience right now and have become my lifelong friends, hopefully. Tanya and Saf, who we all did the masters together, and they've both gone on to become professors themselves at LSHTM and at Bristol. And not only have we stayed friends, but actually we still act as kind of peer support. Tanya has actually been up here to teach our medical students about global health, and Saf has always just been a really good sounding board for research ideas and the like. It's usually over a glass of wine somewhere, but nevertheless, very, very influential. And then when I finished my degree, I applied for a research assistant post, and I was interviewed by Professor Kay Wellins, who became my line manager and my PhD supervisor, and we worked together for 10 years on a whole range of sexual and reproductive health studies over that time frame. And I was reflecting back on this because I know that the competition was quite fierce at this interview, and I need to fact check this by actually asking Kay, but 30 years on, I'm still convinced that actually the reason I got that job is because I was asked some tricky questions at interview, and as you do when you're on the spot, you just pull out whatever you can think of, whatever comes into your head. And a lot of what I said, I was drawing from my experience as a women's health nurse. And the study that I was applying to work on was about the integration of sexual health, reproductive health services, women's health, and so on. And so I'm convinced that experience as a nurse is what kind of nailed me to get that position at the London School. And when I was there, Kay was just establishing this research team. So we all were appointed around about the same time, and we worked really closely together. And we have stayed really good friends. And I'm very happy to say that Sarah here is in the room tonight. And she was the one who held us all together for many years. But what's really great about these colleagues here is that we've stayed in touch, not just sort of socially, but actually Kirsten and Wendy both stayed very firmly embedded in sexual health research. And actually quite recently at Lincoln, when we were starting to establish sexual health research here, they actually, well, it was online, they didn't come in person, but helped us to sort of advised us about the research priorities and so on. And Pat Brannigan, the wonderful Pat Brannigan, who until very recently was the Assistant Director of the NSPCC, he's actually currently the chair of the steering group for one of our NHR funded studies. So those kind of academic bonds have, stayed with me throughout my whole career, really. And then big change, circumstances changed, and I moved to Lincoln. We'd by that point started a family, and I wanted to move closer to home. So I got a job here as a senior lecturer in nurse education, which was a bit of a shift of focus for me, and it was taking me slightly away from research for a while. But what it did is bring me fully background into nursing. And I met these amazing people who were the people who really started up the nursing programme here at Lincoln back in 2006, I think it was. And when I joined, it was new. We were just in our first cohort. And I'm really happy to say that Ruth is here in the room, as is Maria. And it's great. Oh, and Trevor. Nearly forgot Trevor. They're all here tonight. And I think the really great thing about this, joining this nursing programme, was it was very different to my own nurse education, my own training, because actually by this time things had shifted. And what we did see, and I understand that this was the first one of its kind in the country, but this programme back then had a big focus on community nursing. The students spent 50% of their time out in the community on their placements. And it had a big focus on public health, prevention, health promotion and so on, which really aligned with my prior research interests. So it was quite an exciting place to be in that regard. And I spent the first couple of years really getting embedded and getting the programme ready for delivery, because it's all brand new. And so I'm just going to briefly revisit some of those key areas that I touched on earlier, because after I'd been here a couple of years and I was able to kind of settle into and we'd sorted out the resources and the education side, I had the opportunity to then start to build research, and started off very, very small with local pots of money to do local studies, often service evaluations and so on, and gradually built that up. So I'm going to just spend a few minutes briefly talking about each of these areas. First of all, the whole work around cancer, psycho-oncology and living with and beyond cancer. Now, I didn't get involved in this because I had any kind of clinical expertise in that field, but it was, I think, because of my status here as a senior lecturer in nursing and my connections out into the community, and the links I made back then, particularly with across what's now the ICB, the Living with Beyond Cancer team that was led by Kathy McPeak, who's here in the room. We started to find small pots of money to fund research locally, and I'd need a whole week to tell you about all of that, because this has absolutely exploded into a whole huge amount of research now that is very much driven and led by my great pal, Dr. David Nelson, who over the last 7 or 8 years has really driven this forward, and now this is a whole body of research that is out there and international. And the example here, this is a very new place-based research network for cancer equity that David has brought together some really well-known kind of global experts in cancer policy, in consultants in oncology from across the 4 nations of the UK. And that's just one example of all this amazing work that has started. I'm very proud of my kind of small involvement in the early days to get this going. And I'm very grateful to David for being very generous in including me in this moving forward. But the baton is very much handed over, and I'm sure it won't be very long where you'll be able to come and listen to David's Inaugural in the future about all of this. The other work that I'm really proud to have been involved in was a whole body of work that we did a few years ago about domestic violence, specifically within the Polish community living in the UK. And this was very much driven by my great friend Anita here, who is now at Sheffield University, and it's very much her area of expertise. It wasn't my area of expertise at all, but the reason Anita invited me on to collaborate with her and to put in and we managed to secure funding was because of my background in nursing and my background in women's health particularly, but also those connections through my sort of position in the School of Health and Social Care as it was then, because I collaborated with a whole host of other academic nurses, social workers and so on. And it was that connection into those other academics, but also into the local services that I was invited, because that's the kind of value that I could bring rather than the expertise in the topic area. And I think there's an important message for them, for lots of academics who maybe are heavily involved in teaching, but they haven't got that research expertise, but that's really valuable to bring that the fact that you are a registered health professional into a study and to open the doors for interdisciplinary collaboration. And so what this did is we were a team together. My great pal Michael Razel, who's an expert in social policy, who now works over in Innsbruck, and the amazing Ivona, who is a Polish sociologist who came to the UK to work with us on this study. And I'm absolutely delighted that she's here tonight. She's travelled all the way down from Scotland to be here just for tonight. So that's just fabulous. But what this also did is open doors for me to work across with other great academics that have worked in this area, Karen Harrison being one of them, who's in the room, also Lindsay Harris. And we also managed to secure some PhD studentships as well. And then the last area of research that I want to talk about is this whole body of sexual health research that I'd done for 10 years at the London School, but wasn't really able, it took me a while to be able to get established in that again. So over the last probably about 5 years now, we've started to develop a whole body of work around sexual and reproductive health. And what is really satisfying for me is that this research has come almost like full circle, because it was supported largely by key people here. This is Professor Caroline Sabin, who is at UCL, and she is internationally renowned HIV epidemiologist, and Professor Kath Mercer here, who's also at UCL, and Kath now leads the National Survey of Sexual Attitudes and Lifestyles that I had worked on sort of on the periphery of 30 years ago. And a lot of this work was made possible by this person who's sitting here on the front row, my colleague Helen Malcolm-Jones, and it's through Helen's creativity and drive and really hard work that we were able to sort of establish new research in this area. And Helen and I were both awarded honorary contracts. What's the word? Yeah, back at UCL. So again, that was for me really satisfying to sort of see things come full circle. But the other huge thing that happened to me after a couple of years at being at Lincoln is I met these two people who are both here in the room. And this was the first time that the kind of concept of being a clinical academic, so being a nurse who's embedded in clinical practice, but also following a research career, it's the first time I'd ever been introduced to this idea. And we'd need all day to talk about this, but really a lot of this work, which has now become really established nationally and internationally as well, this idea of clinicians also working across, bridging into research, was really largely down to Chris Jackson and Tony Butterworth, who are still very much connected with the university because they were given honorary fellowship and emeritus status when they left Lincoln some years ago now. And they really worked together with a national team over a whole body, a whole series of work that was done to ultimately produce this report back in 2007. And this report was hugely influential nationally, and it set out kind of research training pathways for nurses and others later who wanted to become clinically active, stay clinically active, but become research experts as well. And this work is, it was just hugely influential. It was later picked up by the Department of Health. And what has happened since then is this is the initial kind of vision that was set out in the report back in 2007, where Chris and Tony and a whole body of other experts worked together to sort of recommend that for nurses and later other allied health and social work professionals and so on, there needs to be this kind of pathway that starts off really early as people qualify, right through their careers to support people to become, to get master's degrees in research methods, to do PhDs, to work at postdoctoral level and beyond, such that ultimately somebody could be a consultant nurse for half of the week and then a research professor for the other half, and really cement that kind of clinical and academic bridge. So this was a set of recommendations and a vision that was set out, and 20 years later, this is the reality. So this isn't for you to see the detail, but this is a whole body of research training opportunities, fully funded. Sometimes people get full salary backfill to take a year out of clinical practice to become qualified in research. And there's a whole host of things here. This is the current provision from the NIHR, which is one of the main kind of funding bodies across England for research. And this is all a reality, and it's largely down to the work that Chris and Tony really led on and influenced. And not only are the training opportunities out there now, this whole kind of concept is really fully endorsed nationally with a whole host of national level policy drivers, recommendations from bodies such as the Royal College of Nursing, Royal College of Midwives, the Council of Deans and so on. Throughout all of these policy documents, it's really clear that actually it's necessary for nurses, midwives, allied health professionals, social workers, public health practitioners to be given these opportunities so that they can really bridge that across from clinical into academic practice. And it's no longer seen as a kind of a nice to do thing. It's actually really, it's facilitated by these training programs, but there's also an expectation that actually this will happen and that clinical areas do need to be research active. This quote is from the NIHR website, and it's talking about the necessity to support research in these clinical environments. So it says here that clinical research is no longer just a nice to do exercise in the NHS. It's now a key part of improving patient care. Research is written in the NHS constitution, and it's backed up now through the CQC inspection process. So this whole concept of having research active nurses is kind of fully embedded and expected. And there are, there's more and more there's emerging evidence of actually the benefit of these things. Very, very handily, this article was published just last month. But this is just some of the detail and some of the areas in which having research active health professionals can help to kind of improve the culture, the environment, and ultimately patient experience. And so I've been absolutely privileged to have been in the position to actually be able to operationalize some of these kind of national level recommendations and to do things on the ground here in Lincoln, but also across the East Midlands, to try and put infrastructure in there to help people, nurses, allied health professionals, midwives, social workers, who want to step into research to be able to do that. And this is just a bit of a flavour of some of the things that we've done on different levels. I've led on some of these things and I've supported others, right through regional-wide programmes that are a step into research training, to very local things like just introducing academic writing workshops to support staff and this kind of thing. And this is just a flavour. There's a whole host of other stuff that I've been really privileged to have been involved in and really actually just found this hugely beneficial. But this has not been possible like on my own. These are just some of the people that have supported that in their different ways, either through finding local funding as their position as sort of senior academics within the university, or who have done similar to what I've done. My great friend, Professor Mo Ray here, has just done a huge amount of things to support social work research, social care research, and social workers doing research as well. And Rachel Mason, who's in the room, she just works non-stop to operationalise these things and support our academics here to do research. And a big shout out to Kirsten Guy as well and Lorna, who work in the ICB across and in public health, who we work really closely together to put things in place to support people who want to access training and mentorship and so on. And it's just been a really great privilege to have been able to focus a lot of my activity over the last 10 years on this kind of area, to breathe life into the clinical academic career concept, as I think, Tony, you put it quite recently. And we have had you know, we get feedback from the scholars, we get feedback from the people that are doing this, that are working clinically and have gone through these programs. And this is just a bit of a flavour of a whole kind of data set of feedback from the interns. And you can see just from this that just having in some cases, a very brief kind of experience of engaging research is kind of hugely satisfying to ignite that initial passion, right through to actually directing people's future careers and so on. And we're often asked about the impact of these programs and these awards. And this is a survey we did recently with people that have worked across the East Midlands. And you can just see here that they've carried on. It's not the sort of training where you just come and do a course and then move on. It's about kind of embedding that behavioural change so that people are equipped to be able to carry on being productive. And this is just some of the things that people get up to once they've been through the programs in terms of being prolific in collaboration, producing research outputs, and so on and so on. And I think it would be remiss of me just to paint a really kind of rosy picture that this is all perfect and it all runs very smoothly. Of course it doesn't, and there are still barriers, there are still administrative problems to work through. It's not easy having a joint contract between two different organisations. But actually what is definitely there now is the appetite for this. We're approached all the time by nurses that want to do research, and there is a will nationally but also locally as well to really try and figure out how to make this a reality for people. And I guess one of the things that I am really kind of proud of with this work as well is that about 10 years ago we took a decision with the other people, my sort of counterparts across the other universities in the East Midlands, not to kind of compete for funding to be able to deliver these programs in silos at individual universities, but actually to get together as a sort of consortium and deliver a regional-wide program rather than kind of individually. And so there's a whole host of people that are really involved in this across the whole region. I just want to showcase one particular person without embarrassing her too much because she's right here in the room. But this is just an example of, you know, an amazing person, Trish, who was one of our undergraduate nursing students. And during her time, she showed an interest in research, and we were able to create an academic fellowship for Trish and some others who, after qualifying, stayed with the university a day a week to get involved in research projects. And that was some years ago now, quite a while ago, I can't remember how long. But since then, this is just a list of all the things, some of the things that Trish has been up to. And she's really become an ambassador for supporting research back in the NHS, in her organisation. She's currently doing her own master's in clinical research delivery and has become a real ambassador and a champion for research active nurses. And this is her actually presenting this at an international conference a while back with another student of ours. And this photograph she sent me a couple of months ago, and this is actually Trish at, is it the RCN research conference? Hobnobbing with no other than Professor Jane Ball, who many of you will know, who's one of the leading nurse researchers internationally. And one of the things that we try to instill throughout the programs is about that and the importance of networking and collaborating and just not being frightened to approach people. So there's kind of living proof of it in action. Okay, the other huge thing that, again, and this is largely down to Chris and Tony, that I've had the absolute privilege of being involved in since 2011, I think, is this network of nurse academics from right across Europe. This was an idea that was created, and Chris Jackson, Tony Butterworth, was along with Sarah Owen, who many of you here will know was our previous dean, got together with some colleagues from Italy and Slovenia to create this network of nurse professors and nurse educators right across Europe. And I've been the chair of this group for about 4 years now, and what it now involves about 60 individual, mainly professors of nursing from right across Europe, from I think it's about 23, 24 countries now. And we meet once a year in person whenever we can, and it has led to a whole host of international collaborations, research outputs, but also kind of opportunities for student exchange. We've been over to several countries with nursing students. Again, Rachel has been involved in that with some of our other nursing academics. And so it's just been absolutely brilliant and so valuable to be a part of. And it's allowed us to have the opportunity to talk about clinical academic careers right across Europe and actually further beyond as well. Because this is not just a kind of UK initiative, this is a kind of a global phenomenon now, this idea of developing clinical academic careers. And I've been really happy to be able to talk about this across Thailand. I'm now visiting professor in a university down here in Surat Thani in Thailand. And what we've been able to do, and actually this has been largely on the back of our own PhD students who have graduated and gone back home. Here, a pharmacist who now works at the university up here, and nurses. And throughout these connections, we've managed to link up nurses and pharmacy and other academics working in these 4 areas of Thailand to facilitate collaboration and active research partnerships. And this is just some of the outputs that are emerging from that. And it's really been wonderful to be able to do that and to facilitate that. And this picture of me and Chris in Thailand just to prove it that we were there. Yeah. And I really want to acknowledge as well and congratulate the many PhD students and postgraduate research students that I've had the absolute privilege of supervising and supporting. Lots of them are in the room. And the key thing here to know, I think, for the most part, these are all nurses who've now got PhDs. These are 2 social workers, dental health professional, pharmacists. This is one of our medical students that did a master's with us recently. So really kind of living, breathing this kind of idea of being a clinical academic. And some have gone on to have really kind of senior academic positions. And just notably, these 2 people who are both in the room were both very senior managers and leaders in the NHS at the time that they did their PhDs with us. So that is a different type of clinical academic, because it's in management rather than in clinical practice. And it's just been an absolute joy to have played my small part in supporting these people along the way. Forgive this absolutely horrible picture of me that my kids took last night, looking suitably exhausted and ready for retirement. And this actually replaced a beautiful AI-generated image that I did have on this slide, and they would not let me use it. So you got the real me. So I have been kind of reflecting a lot in the preparation for tonight, but also, coming up to retirement. And I was thinking, would I do things differently if I was doing it all again? Because as you've seen, I haven't actually become a clinical academic. In many ways, my clinical practice and my academic practice moved further apart as I started to do research. And I wouldn't say I regret that, but I have a certain level of sort of, I suppose, sadness about that, because I wasn't able to stay clinically active. I am still a registered nurse, but I haven't worked in the clinical setting for longer than I care to think about. But if you look back, it looks like my career could have been kind of quite linear and quite well planned, because things always do look better, don't they, in retrospect? But it wasn't. It was opportunistic, and it had this series of kind of closing loops and coming back in circles and so on. So, but I'm not sure I would do it again differently. But if I was starting out now, starting out as in nurse education today, I think probably I would. And that's because the landscape is different now. Nursing today is so different to what it looked like 40 years ago. But these opportunities are out there now, and they are there for the taking, really. They're competitive, but still the opportunities there. And this kind of option to have a joint clinical and an academic career is now a reality. And I'm really pleased to have been able to make a small kind of contribution to that in terms of setting up the infrastructure across this region. So that's it in terms of the serious side of things. I will ask you, if you will, just to kind of indulge me a little bit longer while I do some personal thank yous. First of all, thank you guys, everyone, for being here. It's really, that's really very moving, actually. I'd like to say a big thank you to this LSHTM posse. Lots of them are in the room, being on very good behaviour across the middle there. Because these people that I worked with for a long time at my time at London School, we've stayed lifelong friends, but also academic collaborators as well. Jenny and Sarah, who are both here, were the professional services team that basically ran the London School, single-handedly, all together. And my other great friends who are still supporting us. Dr. Dahlia Marks was instrumental in supporting our recent validation of our new Masters in Public Health by being on the validation panel. And Professor Judith Green here, no research methods reading list would be complete without all the writings of the qualitative method books of Judy Green. And I'm really happy that you're here too, Jude. I'd like to thank these ladies who are in the room, who have basically been the mainstay of my kind of social world since I moved back to this area over 20 years ago. We've just had some amazing times as we've kind of gone through our lives together, and it's great that you're all here tonight. I'd like to thank my kids, Ewan and Will, who are both over here, just for being fabulous and for introducing us to the arts through your passion for music and literature, to stuff that we would never really have been exposed to. And it's great that you're both here tonight. I'd like to thank my husband, Neil, for putting up with me for 35 years. And I wanted to formally and officially acknowledge your contribution, and that I wouldn't have been able to have the career without you doing everything. Literally everything. It's great that my sisters are all here tonight. So I couldn't find a photo of us as kids or even recently. So this one's from the 80s, I think. And I'd really like to just acknowledge the influence and the contribution that my dad had. Even though he died almost 20 years ago, his influence lives on. Not always in a good way. You'll see here he was actually a bookie. So he did tell us a certain thing about taking risks and so on. But yeah, he was a great, more stories about him maybe in the pub later. And finally, I would just like to acknowledge the lifelong contribution, support of my wonderful mum, who's right here, for her just amazing support, wit, and great deadpan Glaswegian humour, who's just kept us entertained and cared for a lifetime. And I'm really looking forward, as I step down next month, to be able to just hang out and have some really good quality time with you. And so thanks again, everyone. I will just like to dedicate this to Kevin, who died on Saturday, our little dog. I'd really like to invite you, anyone that can make it after this, directly over to the pub, because this is going to be a sort of joint celebration for Kev's life, but also, for my retirement. And you're all very welcome to join us in the Cardinal's Hat, where I think we will be for the rest of the evening. So thank you again, everyone. Thank you. That's lovely. Right. I don't.
Ros, that was absolutely fantastic. We're going to miss you hugely. I mean, what strikes me more than anything else from that talk is how everybody that you've come across in life wants to stay in touch with you, remain friends with you, and it's totally understandable why. So, huge thanks again. We don't normally do questions, but we could take one or two if people have any.
It's not necessary.
Oh, go to the Cardinal's hat and ask one over a drink.
Yes, that's a much better idea. Yeah,
Yeah, thank you again. That was
brilliant.
really
Thank you, Simon.